Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Celiac disease. It's an immune reaction to eating gluten, which is a protein found in wheat, barley, and rye. And interestingly, it affects more than 3 million people in the United States. Now, if you have it, eating gluten triggers this immune response or inflammation in your small intestine. And over time, that can cause problems trying to absorb some nutrients called malabsorption. Your body can't absorb the nutrients that it needs. And if it goes on long enough, it can cause some serious health problems.
So what are the symptoms and how do you find out if you have it? Oh, and what's the treatment? And most importantly, if you don't have it, is it still a good idea to avoid gluten in your diet? Joining us in studio is a celiac disease expert. My favorite one, by the way. Mayo Clinic gastroenterologist, Dr. Joe Murray. Welcome back to the program.
Thank you for having me.
Dr. Murray, good to have you. We've got so many questions about celiac disease, but the first one I want to ask you is I was at a restaurant recently, and I was looking at the menu, and many of the entrees had GF beside them. I assume that meant gluten-free. Why are people that don't have celiac disease, and I assume most people who go into a restaurant don't, why are they trying to avoid gluten?
Well, some of that, I'm afraid, is fashion. It's the power of perhaps certain media figures or celebrities who've endorsed a gluten-free diet for reasons that aren't necessarily scientifically based. We know people with celiac disease need to avoid gluten. That's without question. However, people who don't have celiac disease, there really isn't a lot of good evidence to support people avoiding gluten for the good of their health, for example.
And wasn't it a physician who started this gluten-free fad?
Well, there are probably more than one physician, actually.
Really?
And so there has been a number of popular writers, let's say, who have written books that in the past several years that have purported to suggest that lots of things in your health will be improved by avoiding gluten. Unfortunately, those are not based on science or even based on solid facts. So
what's happening? Because, I'm sure all of us know people who say, I stopped eating gluten, I feel so much better. Isn't it kind of that it's a cross with you're not eating bread or carbohydrates that maybe upset your stomach?
So wheat itself is quite a complicated grain. It's got lots of different things. We know gluten is the protein within wheat, and that triggers celiac disease. But there's also starches, there's fiber, and other things that go along with wheat. And then you put that into foods like pizza, my favorite. You've got lots of other things in pizza that could upset you. There's also the fact that lots of fast food contains gluten. Avoiding gluten may make it harder to eat so much fast food, and eating fast food might not be good for you.
So is there such a thing as non-celiac gluten sensitivity? In other words, are there some people who don't truly have celiac disease, but they're sensitive in some way to gluten?
Yes. And I think, Tom, yes, indeed there are. It's probably not as common, almost certainly not as common as the number of people who are avoiding gluten. But within those people who report, I feel better when I avoid gluten, maybe some of them have celiac disease. And there are some who don't have celiac disease, but for some reason their body reacts to wheat. It's not clear that it's the gluten that's in the wheat. It could be some other component, one of the starch components of wheat, that could be the problem.
So we call that just the sensitivity. Then you fall into that category?
Yeah, you can use the term sensitivity or an intolerance to explain that. Unfortunately, there's no good test for it. So I think it comes down to good sense. One, I always tell people, be tested for celiac disease. If you don't feel well and you think it might be related to bread or wheat, for example, be tested for celiac disease first before you reduce gluten.
Because there are a lot of people, or a fair number of people, who have celiac disease and don't know it. Is that correct?
Yes, probably at least half of the patients out there who have celiac disease have no idea that they have it.
So it would be beneficial to go and get tested, but you should not, I remember from you saying in the past, you should not alter your diet before you go get tested.
Exactly right, Tracy. If somebody goes gluten-free or even gluten-reduced before the blood test can be false, negative, and misleading.
Is the blood test definitive?
The blood test is not definitive. It can be a very good indicator. In somebody eating gluten, it's usually quite sensitive. It should pick up 95% of people with celiac disease, which is pretty darn good for accurate for a blood test. It's not perfect. You can have false positives. So usually we recommend that somebody see a gastroenterologist and consider having an endoscopy so we can biopsy the part of the body, that's the small intestine, that is damaged in celiac disease.
Endoscopy meaning you put a tube down the throat,
Yep.
down into the small bowel and get a biopsy, and that's confirmatory.
Exactly. And we do that under sedation.
But that's a good thing. But most of the time you don't need to do that. The blood test, you're good enough.
If the
for
blood
that.
test is negative, usually you're good enough. You don't need to proceed to the endoscopy. But if the blood test is positive, then it's suggestive but not diagnostic. And that's the circumstance that we feel that really the endoscopy is the most helpful, confirming the diagnosis.
But don't most people say, well, my blood test is positive, or is positive for celiac disease, and I'm just going to stop eating gluten and not have that endoscopy? Do you run into that or no?
Yes, we do. And sometimes I run into those patients 6 months or 12 months later where they don't necessarily feel better. And they're wondering, is this very burdensome diet, because it can be quite burdensome for some people, is it worth it? And I'm stuck in the position that it's much harder then to make the diagnosis when they already have been gluten-free for a few months.
All right, let's talk about the symptoms. It could be, as you mentioned, there's a lot of people out there who have celiac disease, don't know it. What are they feeling?
So the most typical symptom is diarrhea, abdominal bloating, gaseousness, especially flatulence that's quite malodorous, I mean stinky. Problems with fatigue is also quite common. We see consequences of malabsorption, like anemia, for example. Weight loss, bone disease can be issues. But all of that said, there are plenty of people out there who have celiac disease who don't have weight loss or diarrhea or anemia. They just don't feel well. And they especially don't feel well after meals, but they don't understand why.
Well, because it sounds like it's almost a completely different disease when you look at those symptoms side by side.
True, even though when we look at the blood tests or we look at the intestine, they're indistinguishable.
So what actually happens inside the small intestine if you have celiac disease and continue to eat gluten?
Yeah, in the small intestine, we have these lining cells, we call them villi. They're little finger-like projections. They make it look like a deep pile carpet. And that's really the workhorse of digestion. We have all our enzymes for digestion and we absorb our nutrients there. In celiac disease, those become inflamed and flattened. So we don't have that deep pile carpet anymore. It looks more like a mosaic tile floor. And we don't have the ability to absorb certain nutrients, like iron is especially one of the most common ones. Or if stuff passes right on through us without being digested, we can have diarrhea.
So can those villi bounce back?
Oh, yes. Now, I wouldn't use the term bounce. They grow back. In children, they can bounce back quickly within weeks. In adults, it takes months or sometimes even years for the villi to recover.
Is this, do we know what causes this? Is this always inherited or not necessarily?
We know that it's triggered by gluten. That's the protein in wheat, barley, and rye. We know people need to have certain genes, but those genes are very common, especially in Caucasians. About 30% of Caucasians carry those genes. But not 30% of the white population actually gets celiac disease. It's more like 1%. So there's something else missing from that equation. Family history, I would say half of the patients have a family history. The other half don't have any.
When it comes to the progression of this disease, meaning, 50 years ago, when I was growing up, I never knew anybody, never heard anything about celiac disease. And I know that environmental factors have changed and our food sources, the way that food is, the way food is produced for us. Is celiac disease increasing in frequency, or does it just seem like that because we're talking about it more?
I think it's both. We have data showing that it has truly increased in frequency, not only in the United States, but across the world. There has been a dramatic increase in the disease. Not just that we're finding it. We do have better tools for finding it, but there is a lot more of it about. Why has that happened? Wheat itself probably hasn't changed. It's essentially the same. Our wheat plants are a little shorter. They grow more seeds, but the actual wheat proteins probably have not changed very much. There certainly are changes in what we're eating. We are eating a lot more. I mentioned pizza earlier. We're eating a lot more pizza than we were. We're eating a lot more fast foods, a lot more baked goods. are being eaten. Is that a clue? Perhaps there's a little bit of new data from Europe suggesting that very young children who are at risk for celiac disease, and we know this because of a family history, if they get more gluten in childhood, they're going to get more celiac disease. So there's something about dose in children at genetic risk that's important.
You mentioned that about half of the cases are inherited. So if someone is diagnosed with celiac disease, should their immediate family members be tested?
Yes, and that applies to parents, siblings, and children. Doesn't matter how old the patient or the relative is, I recommend that they be tested.
All right, our guest and expert on celiac disease, Mayo Clinic gastroenterologist Dr. Joseph Murray. Time for a short break. When we come back, we'll talk about the complications of celiac disease if you don't stop eating gluten, and we'll talk about the treatment, which is relatively straightforward. Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
We're with a celiac disease expert, Mayo Clinic gastroenterologist. That's a big one, isn't it? I mean, he's a gut doctor, right? Dr. Joseph Murray, we're talking about celiac disease. We've talked about the symptoms. We've learned that you can diagnose it with a blood test, but a more definitive test is endoscopy. We've learned that 50% of cases are inherited. But let's talk about, before we go on to treatment, other risk factors. Isn't it true that if you are a type 1 diabetic, you're also at increased risk?
Yes, indeed, Tom. So people with type 1 diabetes have this autoimmune background that makes them more prone to other autoimmune diseases. So as many as 6 or 7% of people with type 1 diabetes will develop celiac disease in their lifetime. And that can be important. It could affect their ability to digest and absorb, which of course could affect their blood sugars, especially after meals. So that's one particular group at risk. And people with other autoimmune diseases, lupus, for example, Sjogren's syndrome, these other autoimmune conditions, they're also more prone to celiac disease.
Aside from feeling miserable, what are some of the complications that celiac disease bring on?
So we've mentioned malabsorption, so things like anemia, osteoporosis or osteomalacia being a softening of the bones,
Brittle
the osteoporosis,
bones,
brittle bones. Those patients can get premature fractures, there are increased risk of fractures. There are also more serious problems, certain malignancies of lymphoma being one, or cancer of the small intestine are more common in patients with celiac disease. Now, thankfully, they're still quite rare, but when they happen, they're devastating.
But if you do get celiac disease or have celiac disease and avoid gluten, can you avoid the complications?
Generally, yes. So the risk for those complications is greatest within the first year or two after diagnosis. After that, once somebody's been gluten-free for 2 or more years, usually the risk of those complications recedes and drops to a level that's no more than the general population.
So I guess you sort of answered the question about what the treatment is. Avoid gluten. So what can you eat and what can't you eat?
Well, of course you have to avoid gluten, and gluten being that protein that's present in wheat, barley, and rye. And of course, wheat is used in lots of other foodstuffs. So one has to be careful about things like sauces, marinades, seasonings, for example, can all be contaminated with wheat in some way. There can also be cross-contamination in kitchens, for example, where there's a lot of airborne flour. That flour is going to land on other things and cause cross-contamination of those other items. Gluten-free is now well defined by the FDA, has a set a threshold of less than 20 parts per million, can be labeled gluten-free. And if something is labeled, it's usually reliably gluten-free if it's packaged foods. Restaurants with a little GF symbol, not quite so certain. And a recent study suggested that as many as 30% of so-called gluten-free foods in restaurants might not be totally free of gluten. Now, does that mean they're always hazardous for celiac patients? Not necessarily.
That's dangerous.
Well, it's a concern at least. And patients with celiac disease live with this burden of care that they have to carry out every time they eat.
It's kind of like when it comes to our diet, it's kind of like keto diets have taken on a new celebrity culture. And I think that gluten-free is the same thing. There's an actual diagnosis. There's people that struggle and live with it every day. There's people who need to have a real keto diet. But the terms kind of get thrown around, and it's not harmful if you don't have gluten sensitivity. If you're not celiac, it's not harmful to eat more healthfully. So why is it a big deal to get this message out?
Well, severalfold. One, people who have symptoms need to have those analyzed. They need to know what's causing those symptoms. Is it celiac disease? Get tested before you avoid it. If it's not gluten or not celiac disease, it might be something else wrong with your gut. A gut that is damaged or injured will probably feel bad when you eat. It doesn't mean it's the problem with the food. It may be the problem with the gut. That's what your friendly gastroenterologist is for. The other issues, the issue of avoiding gluten without a diagnosis, there may be issues because when you go gluten-free, you avoid a lot of fiber, so you're going to get fiber deficient. A lot of cereals are fortified with thiamine and other nutrients. Those are necessary, certainly necessary in biology. They're quite important for reproduction, for example. We don't want people deficient in those. And there also may be other things that certain foods that are naturally gluten-free may perhaps have more contamination with things like heavy metals, like arsenic. So certain, say, rice sources have more arsenic. And there's been issues about accumulation of heavy metals in people who are eating a gluten-free diet, even without the diagnosis. So I don't think we should change our diet without a good reason for doing so.
Is it important if you're diagnosed with celiac disease, newly diagnosed, that you see a dietitian?
Yes. I mean, central to this is to learning how you're going to do this. This is not a casual endeavor of playing at gluten-free. This is a completely different lifestyle, and it's medically mandated, and a dietitian, an expert dietitian, is crucial to doing that successfully.
The people who have diagnosed, who have self-diagnosed, what should they do? Should they stop, go back to eating regularly, then come and see you to get tested?
If it's been a very short time, like a week or two, go back eating gluten, go see their doctor.
What if it's been a couple of years?
If it's been a couple of years, that's a little more tricky. They should probably see their doctor anyway. We can do a type of genetic test that if it's negative, it rules out celiac disease. But that's only if it's negative. And as I mentioned, a third of the white population have the genes for celiac disease. So in that third, we won't know. Then we're faced with a gluten challenge, which means putting them back on wheat and other gluten-containing foods for several weeks to see if the symptoms come back, do the blood tests become positive, and does the intestine become damaged.
All right, the condition is called celiac disease. It affects at least 1% of the population, and there are a lot of people who have celiac disease and don't yet know it. Hopefully they've listened to this program and will go in and get tested. The symptoms include diarrhea, fatigue, abdominal pain, weight loss, bloating, and gas. There are 2 blood tests that can help diagnose it, and a strict, lifelong, gluten-free diet is the only effective way to manage it.
And if you don't have celiac disease, well, probably not a good idea to avoid gluten in your diet.
Well, and there's no good scientific evidence to suggest that you should if you don't have celiac disease.
Our thanks to Dr. Joseph Murray, Mayo Clinic gastroenterologist and celiac disease expert. Thank you.
Thank you.